Good day, everybody. This is Chris with the Ancient Scholar, and today I'm going to go ahead and review a very new piece of literature that has come out, and this is a literature that was recently published in the New England Journal of Medicine. It came out 4 October 2012. You can find it the New England Journal of Medicine, and you can also find a link to this article on the Society of Critical Care Medicine website. The name of this study is the IABP Shock 2 trial. This was a study that was spearheaded by Dr. Thiel and al. And what it looked at is the efficacy of intra-aortic balloon pump counterpulsation augmentation therapy. In the years past, in spite of rather scant evidence, there isn't a whole lot of literature out there, but the intra-aortic balloon pump has been kind of a flagship mainstay treatment modality for patients who are experiencing cardiogenic shock, in spite of a very modest amount of evidence that actually supports the use of intra-aortic balloon pump therapy. So the aim of the Shock 2 trial was to develop some established endpoints, and they took two groups of patients, a sample of patients in little n equals 300, where these patients that met the criteria for this trial. I'm not going to go over all the inclusion and exclusion criteria, but essentially what they did was they took patients that developed cardiogenic shock, generally as a result of an acute myocardial infarction, that specific group of patients. And they had a group of patients, 300, that received conventional, traditional intra-aortic balloon pump therapy, and then they had a sample of patients, n equals 298, that received no intra-aortic balloon pump therapy. So fairly close as far as the number of people in each sample size, 300 versus 298. Their primary endpoint was 30-day mortality, and 30 days out, there was no statistical difference in the relative risk of death between the two groups of patients. Had a very high confidence interval. The p-value was exceptionally low in these patients. Secondary endpoints they looked at were differences in specific laboratory testing, such as serum lactate, C-reactive protein, liver function tests, renal function testing, and so on. In the secondary endpoints, they found no statistical difference between the intra-aortic balloon pump group versus the non-intra-aortic balloon pump group. So the conclusion of this trial is essentially that in this specific setting, in the setting of patients experiencing acute myocardial infarction, at least in these samples of the population that they took, there does not appear to be any statistically significant advantage to placing these specific patients into intra-aortic balloon pump therapy, or there's no specific advantage over medical therapy that does not incorporate the use of an intra-aortic balloon pump. Now, the intra-aortic balloon pump may in fact have validity and efficacy in other patient populations, such as patients that have angina or angina-like chest pain that does not resolve with conventional therapy, septic, certain maybe septic shock, and some other issues that go on, or patients that have cardiac calves and that come out of cabbage. We don't really have a large amount of evidence, large amount of literature. Obviously, the scope of this study was somewhat of a narrow scope, but I do think this is an important study, and it does show that there may in fact not be as big of benefit to using intra-aortic balloon pump therapy as we traditionally like to think. It challenges convention, and I certainly think that it could hopefully open the floodgate for more research into this modality, particularly because this modality has been considered a flagship type of intervention for certain patient populations. Okay, guys, if you want to look at the entire study and look at the methods and a complete look at the statistical analysis, you can go online, the New England Journal of Medicine, and you can look this up. This is the intra-aortic balloon pump shock 2 trial, was published on 4 October 2012, the New England Journal of Medicine. Again, the author is Dr. Thiel and Company. Okay, guys, as always, thanks for hanging in there.